Hi everybody, Dr. Holly Tucker here, and I'm going to be talking today about my adaptation of what is modern acupuncture. So you may know that acupuncture originates from ancient Chinese medicine between 3,000 and 5,000 years ago. Records date back that this was used as a healing practice, but it wasn't the only thing that was used in ancient Chinese medicine. They had other modalities that they used, such as herbal medicine, meditation, Tui Na or bone setting, and they also use Tai Chi or like a movement type daily exercise. So we know that acupuncture certainly had its place, and it can be used for many different things. And what they believed historically, before we had anatomical names for things, was that there was an energy flow that was going through the body, and they called this qi, and it flowed through certain pathways or meridians, and that's where they found the acupuncture points. But how do we adapt that today to how we know and understand the physiology of the body and what's going on within our body systems? So there's actually been some modern research that's been done within the medical community to figure out the what and the why and the how of how acupuncture works. So a few things that we do know. Anytime we stimulate the body, there's going to be a few responses that happen. The first is a neurological response. So anywhere where we stimulate the body, in this case we're stimulating with a very small needle, and I have a pack here to show you. So this is actually a little pack of 10. So you see that blue tube in there, it's just a hollow tube that we use to guide the needle down through. This main part that you see is just the handle. You can barely see these little tiny filaments. There's 10 in this pack, okay? And usually when I see a patient, I'm not using more than about 10 or 12 needles per session anyway. And so they are very small and you barely feel them, but there is going to be a response from the body. The body feels it essentially. So there's a neurological response. There's receptors within the skin that are going to light up and send a message up through the spinal cord, up to the brain. And they've been able to prove this with MRI studies. So what does that mean for you? We know when we direct energy towards the body, we try to bring attention to a certain area, that there's going to be a new healing process that has started. And so there's also an immune response. We've done tissue samples, and so we see that there is an immune response that happens anywhere where we put a needle in. So for someone that comes in for headaches, for example, we may treat, the area, if the headache is being felt here, we may treat here. And people may feel relief from pressure in that area, but there's also some other places in the body that we can stimulate neurologically that are going to help with that pain. And so one of the main master points we have is right here. You see at the end of the crease between the thumb and the finger. And this one is a point that I tell people to stimulate on their own, and sometimes I even give people, this is a little spring that they can use to stimulate that point. So that's like probably the most famous acupuncture point. If you had to know one, it's called large intestine 4, and it can be used for head and neck pain. So again, what does this mean? What does acupuncture mean in our modern society? I had the pleasure of speaking at a women's event very recently, and so I talked about what are the major stressors that are impacting American women today, busy moms, newly retired, or just professional women. We know that stress underlies a lot of conditions, and so I highlighted 3 stress-related conditions that I see a lot of in my practice. And the first one is pain, but more specifically headaches. So we know that if there's any sort of a pain going on in the body, it's number 1, an alarm system, and number 2, something that we need to take care of. You don't want to expect to live with that for the rest of your life. And so there are options. There are options that you can do before you have to resort to taking drugs or having a surgery or something like that. There are lifestyle type options, and then there are intervention therapies such as acupuncture and chiropractic that can help with that, and also manual therapies. The second stress-related condition that I discussed in my talk last week was something that's underlying, something that you may be struggling with and you don't exactly know how to pinpoint it. It may be anxiety. So number 1 side effect of acupuncture that I see here in my office is a stress relief or relaxation, and that's an okay side effect if you ask me. Acupuncture overall very safe, a very low risk, and so I'm okay if a patient falls asleep in our acupuncture suite. Okay, that's something that's acceptable to me. So I'm here actually in one of our acupuncture suites right now. So it's a quiet space. We turn down the lights, use the lamp back there. I've got a table warmer, nice wide table where patients are comfortable. And then the third main condition that I talked about was something that's not always seen, something you may be struggling with that again is an underlying condition, and that may impact a woman's life on a day-to-day basis, and that can be digestive issues. So I'm going to be doing a series of videos where we unpack each one of those main 3 stress-related conditions over the next couple of weeks. And just try to get the information out there. So if you have any questions, please post them below in the comments of this video so that I can address them the next week. Or you can go back to the main page and just hit messenger and send us a message and ask us a question. Ask me directly if you're interested in what acupuncture can do for you and what it can mean for you. My ultimate goal is that we're impacting the next generation of health, and how we do that is we go through the women. Women are the healthcare decision makers in the family, and so we want mom to be healthy, we want grandma to be healthy, we want your daughters to be healthy, so that we can impact the next generation and have everybody live happy, productive lives. So I hope everybody has a great day, and we will continue this series, so I hope you enjoy it.